Hello, my name is April Baller. I work in the WHO Health Emergency Unit, and I'm the focal person for infection prevention control. So today we're going to go through a module which is specifically looking at infection prevention control and clinical care. To avoid transmission, the general community needs to avoid agglomerations and frequency of closed, crowded spaces. They also need to maintain a distance of at least 1 meter from any individual who has novel coronavirus respiratory symptoms such as coughing or sneezing. Perform hand hygiene frequently using alcohol-based hand rub if hands are not visibly soiled for 20 to 30 seconds, or soap and water when hands are visibly soiled for 40 to 60 seconds. And also refrain from touching mouth or nose. Individuals with respiratory symptoms should wear a medical mask and seek medical care if experiencing fever, cough, and difficulty breathing as soon as possible or in accordance to local protocols. Healthcare workers may be at risk of infection. Early respiratory infection symptoms can be nonspecific. Thus, healthcare workers may not be prompted to implement additional precautions to prevent transmission while providing care. Hence, the importance of standard precautions. Use standard precautions for all patients in all settings at all times, regardless of symptoms. Standard precautions include hand hygiene, respiratory hygiene and cough ethic, use of personal protective PPE based on risk assessments, and also apply safe injection practices. Standard precautions include environmental cleaning, waste management, linen management, and care of patient equipment. At Triage, early recognition of patients with novel coronavirus is very important. Have a high level of clinical suspicion of novel coronavirus. Give the patient with suspected novel coronavirus a medical mask. Place the patient in a separate area, as this will contribute to source control and diminish potential for environmental contamination. At Triage, also ensure that you have a well-equipped triage station. Institute screening questionnaires according to novel coronavirus case definition, organize the space and processes to permit spatial separation of 1 to 2 meters between each patient with novel coronavirus and other individuals. Ensure that there are post signs in public areas reminding symptomatic patients to alert healthcare workers. And finally, ensure that triage and waiting areas are adequately ventilated. Encourage respiratory hygiene. In other words, cover the mouth and nose during coughing or sneezing with a tissue or flexed elbow, followed by immediate disposal of the tissue, and perform hand hygiene. When admitting patients to wards, ensure that only those with confirmed infections are placed with other coronavirus confirmed cases. Healthcare workers caring for patients with novel coronavirus should apply droplet precautions to prevent transmission of viruses via large droplets. These include placing patients in single rooms, or when single rooms are not available, group together those with a similar or same diagnosis. Keep patients spatially separated by at least 1 meter. Ensure that single rooms or wards are adequately ventilated. Using a medical mask if working within 1 to 2 meters of a patient. Using eye protection, which can either be a face shield or goggles when providing care in close contact with the patient. After patient care, appropriate doffing and disposal of PPE and hand hygiene should be carried out. A new set of PPE is needed when care is given to a different patient. Limit patient movement within the institution and ensure that patients wear medical masks when they're outside of their rooms. If possible, use either disposable or dedicated equipment This relates to stethoscopes, blood pressure cuffs, and thermometers. If equipment needs to be shared among patients, clean and disinfect it between each patient use. Ensure that healthcare workers refrain from touching their eyes, nose, or mouth with potentially contaminated gloved or ungloved hands. Avoid contaminating environmental surfaces that are not directly related to patient care. For example, door handles and light switches. Routinely clean and disinfect surfaces which the patient is in contact with. And finally, for contact precautions, ensure adequate room ventilation, use single rooms or cohort patients with the same diagnosis, minimize movement or transport of patients, and always perform hand hygiene. Some procedures, such as aspiration or open suctioning of respiratory tract specimens, non-invasive ventilation, high-flow oxygen therapy, delivery of nebulizers, intubation, cardiopulmonary resuscitation, and bronchoscopy can generate aerosols, so-called aerosol-generating procedures. These are associated with increased transmission of Ncobi. Healthcare workers need to take the following airborne precautions when performing these. Use PPE, including gloves, long-sleeve gowns, eye protection, and particulate respirators, such as N95 or equivalent, or higher level of protection. Use adequately ventilated single rooms when performing aerosol-generating procedures. This means negative pressure rooms with a minimum of 12 air changes per hour or at least 160 liters per second per patient in facilities with natural ventilation. Ask all people not required for the task to leave the room. So now let's talk about signs and symptoms of Ncobi. As with other coronavirus infections, early signs and symptoms in more severe infections are likely fever, chills, cough, shortness of breath. Rapid progression to severe pneumonia and respiratory failure usually happen within the first week. Life-threatening manifestations of respiratory infection include severe pneumonia, acute respiratory distress syndrome. Early recognition of these clinical syndromes allows for timely initiation of infection prevention and control measures as well as supportive therapeutics. Although there is often no specific cure for emerging respiratory virus infection, the following 3 supportive therapies may counteract the symptoms and increase chances of survival. 1. Antimicrobials, suitable for likely pathogens including community-acquired pneumonia or healthcare-associated pneumonia and sepsis. 2. Oxygen. People with severe Ncobi with signs of respiratory distress, reduced blood oxygen levels, or shock should be given supplementary oxygen therapy immediately. 3. Specific therapies for underlying conditions such as diabetes, kidney failure. With coronavirus infections, many people with severe cases of infection have underlying conditions, and this group are at greatest risk of dying. Let's talk about intensive supportive care. What is severe respiratory distress? This means not responding to escalating supplementary oxygen therapy requiring advanced respiratory interventions, which include high-flow oxygen, non-invasive ventilation, or invasive ventilation. How do you care for someone with septic shock? Treat with intravenous fluid therapy and vasopressors to improve targets of perfusion. These approaches generate aerosols, so the airborne precautions outlined in the beginning of the unit must be followed. With respect to therapeutic research, compounds already licensed or in development for other diseases may need to be repurposed for emerging respiratory virus infection. So now we move on to the management of people with asymptomatic infections. Contacts of confirmed cases may identify people who test positive but have no symptoms. Until more is known, people who are found to be positive on RT-PCR testing should be isolated, followed up daily for symptoms, and tested at least weekly or earlier if symptoms develop. Isolation should continue until 2 consecutive upper respiratory tract samples, such as nasopharyngeal and/or oropharyngeal swabs, taken at least 24 hours apart, test negative on PCR. This concludes Module D. For more information, here are some links and contacts. Thank you for your attention.